Good day. I'm doing Nathan G. Nunez from BSN Today. In this video, I'll be talking about on the drug preparations in parenteral and how it is done. But first, let's define what is a parenteral drug preparation. Parenteral preparations are sterile pharmaceutical products administered to the human body by injection. There are three parenteral drug preparations that is being done. These are intradermal, subcutaneous, and the intramuscular. Rather the materials like the cotton swab, the syringes, and the vial. Next is to wash your hands for you to avoid contamination. And afterwards, you put the gloves. After washing and putting the gloves is to verify your patient. Do the 3 checks of our MAR or the medical administration record, and always remember the 6 rights in medication administration, which are the right time, right patient, right dose, right medication, right route, and the right documentation. Now, we are ready to draw up our ID injection. When we're dealing the vial, always need to check the expiration dates, the number, and the manufacturer date. Shake the vial gently and don't forget to explain the procedure to your patient. So in here, we're going to pop up the cup. After that, get a cotton swab and wipe it thoroughly in a circular motion within 30 seconds. And let's wait until it gets dry. After that is to get the syringe, specifically the tuberculin syringe, because I'm doing the procedure of intradermal injection here. Also, make sure that you don't touch this part of the syringe. After that, we're going to draw back our air, and the amount of air will drop up. The amount of fluid we're going to take out of the vial. So, let's assume the doctor's order is to get a 0.3 cc. What we're going to do here is to pull back the syringe until it reaches to 0.3. So in here, we're going to insert the syringe into the vial. With the bevel up, and gently insert it from the stopper of the vial. Push the air and insert inside the vial. And we're going to flip it upside down and pull back to 0.3 cc. Then gently remove it. We're going to change the needle of the syringe. Also, it is important to change the needle of the syringe. The reason why we change it is it's already dull and we don't want to insert it to the patient. Now we're ready to inject it to the patient. On the patient's arm, find the injection part or site by the use of 4 fingers on the forehand. 1, 2, 3, 4. And make sure that the arm of the patient is on the table, relaxed. And you're gonna wipe it with one circulating direction. Then wait until it gets dry. Now, we're ready to inject it to the patient. But first thing to do is to see if the needle is on level up. Put your non-dominant hand to the skin of the patient and make sure it is in 5 to 15 degree angle. Injecting it, but make sure there is a small bump called pleb. And always remember that you don't massage to the injected part. After that, we're going to dispose all the materials used. After disposing all the materials that we have used in the procedure, don't forget to remove your gloves and wash your hands. And finally is to document all the procedures that has been done. The overall difference of the three are only the injection sites, degree angle of the injection, and the syringe that will be used. And that's all. Thank you for watching. God bless.